Have you ever looked down at your feet and thought they were trying to tell you something? Most people don't. They blame dry skin on the weather, numbness on getting older, or a small cut on uncomfortable shoes. But doctors say your feet are often one of the first places where diabetes quietly reveals itself. The frightening part is that these warning signs can appear months or even years before a person realizes their blood sugar is dangerously high. Every day, thousands of people ignore subtle changes in their feet because they seem harmless. Then suddenly, they discover they have diabetes only after serious nerve damage or circulation problems have already begun. Your feet contain thousands of tiny nerves and blood vessels, making them one of the first parts of the body affected by elevated blood sugar. That means paying attention today could help protect your health tomorrow. In this video, we're revealing 9 warning signs in your feet that doctors say should never be ignored because they may point to diabetes. Some of these signs may surprise you, and the last one is often dismissed as completely normal, even though it can be a major warning signal. Diabetes affects millions of people around the world, and many don't know they have it. High blood sugar doesn't always cause obvious symptoms at first. Instead, it slowly damages nerves, blood vessels, and the body's ability to heal itself. Since your feet are so far from your heart, they are especially vulnerable to poor circulation and nerve damage. That's why healthcare professionals often examine the feet during diabetes checkups. The sooner diabetes is recognized, the better the chances of preventing long-term complications. Understanding these warning signs could help you recognize when something isn't right. The first warning sign is numbness or tingling in the feet. This is one of the earliest and most common symptoms associated with diabetic nerve damage, also known as diabetic neuropathy. You may notice a pins and needles sensation, mild tingling, or areas of your feet that simply don't feel the same anymore. Some people describe it as wearing invisible socks all the time, while others say their feet feel strangely thick or disconnected from the ground. High blood sugar damages the tiny nerves responsible for sending messages between your feet and your brain. As that damage progresses, normal sensations begin to fade. Because the process happens gradually, many people don't realize anything is wrong until significant nerve damage has already occurred. The second warning sign is burning pain, especially at night. While some people lose feeling, others experience the opposite. Their feet burn, sting, or ache without any obvious injury. This discomfort often becomes worse while resting or sleeping, making it difficult to get a good night's sleep. The damaged nerves begin sending incorrect pain signals to the brain, creating sensations that seem to come from nowhere. Some individuals describe it as walking on hot pavement, even when their feet feel cool to the touch. Persistent burning pain should never be dismissed as simple aging, because it may indicate underlying nerve problems related to diabetes. The third warning sign is slow healing cuts, blisters, or sores. Everyone gets small cuts from time to time, but healthy skin usually heals quickly. Diabetes interferes with the body's natural healing process by reducing blood flow and weakening the immune system. Even a tiny blister caused by a new pair of shoes can become a serious problem if it refuses to heal. Bacteria can easily enter damaged skin, increasing the risk of infection. Since reduced sensation may prevent a person from noticing an injury right away, wounds can become much worse before treatment begins. This is one reason foot care is so important for people living with diabetes. The fourth warning sign is dry, cracked skin. Dry feet are common, especially during colder months, but diabetes can make this problem much worse. Nerve damage affects the sweat glands in the feet, reducing the skin's natural moisture. As the skin becomes dry, it starts cracking, especially around the heels. These cracks may seem minor, but they create openings where bacteria and fungi can enter. Small skin breaks can eventually develop into painful infections if ignored. Keeping the skin healthy becomes increasingly important when diabetes is involved because damaged skin loses much of its protective barrier. The fifth warning sign is changes in skin color. Healthy feet usually have a consistent skin tone, but diabetes-related circulation problems may cause unusual color changes. The feet may appear pale because blood isn't reaching the tissues properly. They may also become bluish, reddish, or darker in certain areas. These color changes can come and go or remain constant depending on blood flow. Poor circulation limits the oxygen reaching the skin, making it harder for tissues to stay healthy. If the color of your feet changes without an obvious explanation, it deserves careful attention because it may reflect underlying circulation issues. The sixth warning sign is unusually cold feet. While some people naturally have colder feet than others, Feet that constantly feel cold despite a warm environment may indicate reduced blood circulation. Diabetes can damage blood vessels over time, making it harder for oxygen-rich blood to reach the feet. As circulation declines, the feet may remain cold, even while the rest of the body feels comfortable. Some people notice one foot feels colder than the other. Others experience persistent coldness that doesn't improve with warm socks or blankets. Poor circulation is an important concern because healthy blood flow is essential for healing and maintaining healthy tissue. The seventh warning sign is swelling in the feet or ankles. Swelling can happen for many reasons, but when it becomes persistent, it should not be ignored. Diabetes may contribute to swelling through circulation problems, inflammation, kidney complications, or infections. The feet may appear puffy, shoes may suddenly feel tighter, and socks may leave deep marks around the ankles. While occasional swelling after standing for long periods is common, swelling that continues without a clear reason may signal an underlying health issue requiring medical evaluation. Persistent swelling combined with other foot symptoms deserves particular attention. The eighth warning sign is frequent fungal infections or thick, yellow toenails. High blood sugar creates an environment where fungi thrive more easily. Many people with diabetes experience recurring athlete's foot, itchy skin between the toes, or toenails that become thick, brittle, and yellow. Because circulation and immune function may already be compromised, these infections often last longer than usual and may repeatedly return despite treatment. While fungal infections alone don't automatically mean diabetes, repeated infections combined with other symptoms should raise concern. Healthy feet normally resist infection much more effectively. The ninth warning sign is foot pain that seems to appear for no clear reason. Many people assume sore feet are simply part of getting older, especially after spending years walking, working, or exercising. However, diabetes-related nerve damage can cause aching, stabbing, or electric shock-like pain even when no injury exists. Some people notice discomfort while resting, while others feel pain with every step despite normal X-rays or physical examinations. Because nerves are responsible for transmitting sensations, damaged nerves can create pain signals even when the tissues themselves aren't injured. Ignoring unexplained foot pain may allow nerve damage to continue progressing unnoticed. These warning signs often don't appear alone. Someone may first notice dry, cracked heels, then develop numbness, followed by slower healing after a minor cut. Others experience cold feet together with unusual color changes or burning sensations at night. The more warning signs that appear together, the more important it becomes to understand what may be happening inside the body. Diabetes develops gradually, and the feet often reveal its presence long before more obvious complications appear. Doctors emphasize that early recognition makes a tremendous difference. Blood sugar that remains uncontrolled for years increases the risk of permanent nerve damage, severe infections, circulation problems, vision loss, kidney disease, and other complications. However, identifying diabetes early allows many people to manage their blood sugar successfully and reduce the likelihood of these serious outcomes. That's why paying attention to changes in your feet is far more important than most people realize. Your feet support you every single day, yet they're often the most neglected part of the body. Looking at them regularly can help you notice changes before they become serious. Even subtle differences in sensation, appearance, or healing may provide valuable clues about your overall health. Small changes are easy to ignore because they usually don't cause immediate problems, but they can represent the earliest stages of a much larger condition developing beneath the surface. If there's one lesson to remember, it's this. Your feet may be speaking long before diabetes is officially diagnosed. Numbness, burning, slow healing wounds, dry, cracked skin, unusual color changes, constantly cold feet, swelling, recurring fungal infections, and unexplained pain are all signals that deserve attention rather than dismissal. Listening to your body early may help prevent much more serious complications later. If you found this video helpful, make sure to like the video, subscribe to the channel, and turn on notifications so you never miss our latest health updates. Share this video with your family and friends because these simple warning signs could help someone recognize a serious health problem before it's too late. Thank you for watching, and we'll see you in the next video.